All right, the big day has arrived. It's time for your first appointment with a urologist or a urogynecologist. No sweat. Hey, listen, you've prepared for this. You've got your voiding diary, you've got your list of symptoms, you've got your history. You are ready to go and have a really good discussion with a medical professional to try to solve the mystery of your pain. And remember, you are an active participant. You've got to be very involved in this discussion. Now, when you get to the doctor's office, the odds are you're going to be met first by a nurse or a physician assistant who is going to hand you a cup and point to a restroom, because they need you to leave a urine sample, because they're going to do some basic urine testing at that very first appointment, including a dipstick test to see if you might have signs of a UTI, and they're also going to look for blood in your urine. Then they will escort you into an examination room and they will give you a gown to change into, because the doctor will need to look at you down there. So that physical examination is important. Now, when the doctor comes in, now listen, if you're kind of worried and freaked, do your deep breathing beforehand. Listen, no shame, no blame. The doctor does it every day. You have the right to ask for help. You're there to ask for help. Okay, now the doctor has now arrived in the room. You've shook hands. So far, so good. The first thing they're going to do is ask for your history. They want to know, when did your symptoms start? Was there any event that you associate with the onset of your symptoms? Do you have any past history of bladder issues? Do you have any traumas in the past that are involved? This is the time for you to share that traumatic history. The fact that you fell and broke your tailbone, or you fell down some stairs, anything at all like that, that's really important. Just tell that to them. The doctor will then generally move on to kind of looking at urine. Okay, so if your urine comes back negative for nitrites, negative for leukocytes, and you definitely don't have infection, and that's when we're going to look for other things. But if your urine comes back a little bit suspicious, like you do have positive leukocytes and maybe positive nitrites, the doctor, those are both signs that a UTI might be happening. They may send your urine off for additional testing, usually a urine culture. Now, don't be surprised if they also test for lots of other sexually transmitted diseases. That is their job. They need to do that because we need to make sure we know what we're treating here. So don't be ashamed. I can remember at my first appointment, I had not been in a relationship for a couple of years, and I'm like telling them, it's okay, I haven't been exposed to anything. It didn't matter. They wanted to test for everything, and they did test for everything. They're also going to really study any blood in your urine. If you're peeing red, or your urine is brown, or even dark orange, that's a sign that you might have some blood in your urine. We call that gross hematuria. Or the doctor is going to look at your blood under a microscope to see if you have microscopic blood. Both of those are important because you need to have a proper diagnostic workup for that. Blood in your urine could be a sign of cancer. Now, there's no relationship between IC and cancer, and it's very rare. Very, very rarely found in the typical IC patient. But if you were a smoker, if you were exposed to a lot of secondhand smoke, they really need to do a basic cancer workup, which is simply a urine cytology test. That's sending some urine off to the lab to see if you've got some cancer markers in there. Let's just get that out of the way, be done with it. I will tell you, for me, I was absolutely convinced that I had cancer, so much so I couldn't stop thinking about it. And I was really glad they did the cytology, because I could just let that go. I could absolutely let that go and not worry about that at all. Now, the most important part of that very, very first examination is your pelvic examination. So for women, that's going to be through the vagina. For men, that's going to be through the rectum. And so you're going to be in stirrups. They're going to have a glove. They're going to have some KY, and they're going to put their finger in either your vagina or your rectum. And they're just going to touch muscles. And they're also going to touch the bladder just to get an idea of if things are in the proper position, if anything is super sensitive, and most importantly, if the muscles are tight. Our national guidelines from the American Urology Association are crystal clear. They say if this patient is demonstrating any signs of tight pelvic floor muscles, that patient is to be immediately referred to pelvic floor physical therapy. That is important. Tight muscles will absolutely affect the bladder and cause the symptoms that you would normally associate with your bladder, like frequency, urgency, pressure, pain. Now, I have a personal philosophy here, and that is if I'm in pain and I'm uncomfortable, I want somebody to look. I don't like guessing, I like facts. And so for the typical IC patient, the way that they look at the bladder is through something called a cystoscopy. I call it a looky-loo. They basically numb the urethra, stick a scope in, take a quick look around, pull it out, you're done. The only downside of a cystoscopy is it kind of tweaks your urethra and it makes your urethra more sensitive. So the first day or two after having that done, your urethra is going to burn a little bit when you urinate, but it should go away. And this will just allow the doctor to have an assessment of the bladder just to see if there's anything funky going on. And just so you know, for the vast majority of patients, it's a perfectly normal bladder. That sometimes it's red, sometimes it's irritated. For a lot of us, myself included, my bladder was perfectly normal. There is another test that used to be the gold standard for IC called a hydrodistension. And if the doctor does not have a clear understanding of what could be triggering your symptoms, or if you have a lot of blood in your urine, the doctor might ask to do a hydrodistension with cystoscopy to get a much closer look at the bladder wall to make sure that, or to identify if you might have something called Hunner's lesions or Hunner's ulcers, which are basically wounds on the bladder that can bleed profusely. So those are not usually suggested during that very first appointment unless that doctor is very, very concerned. Your pain level might be very, very high. You might have a lot of blood. At that point in time, they really will probably want to take a more closer look at your bladder wall. But what's changed? So today, we're now trying to do a more individualized diagnostic workup, because we really want to get to the root cause of your symptoms. And we do that now through something called phenotyping or subtyping. And that's the topic of my next video.